Hello class, my name is Catherine Sams. I'm going to be your instructor for Pharmacology 2, PHA 236. I know on Blackboard I think it still has your instructor listed as Jenny Miles, but it actually is me. Again, my name is Catherine Sams. I have been, I'll tell you a little bit about myself really quick. I've been a certified pharmacy technician for over 20 years. I've worked in multiple areas of pharmacy, including retail, institutional, hospital, and even a little bit with pharmaceutical robotics while I was employed at the University of Kentucky Hospital. I'll go ahead and tell you now that we're going to go through this PowerPoint presentation. I have also uploaded it to the course documents section of your Blackboard. That is just the PowerPoint and the slides. Your exam will cover all of Chapter 10, so you'll probably need to go ahead and just skim over Chapter 10 in your textbook as well as watching this PowerPoint presentation. All of your tests and quizzes are going to be open book, open note. I did send out an announcement about that, and as to why I do that, it's just because when you are actually working on site in a pharmacy of any kind, you are going to have reference material there at your disposal all the time. It's almost impossible to memorize every side effect, every drug interaction of every drug that's available. That's why we have the physician's desk reference. That's why we utilize Trissels and a lot of different medication journals and stuff that are online, so that we know everything there is to know and we have it there at our fingertips. So going forward, just remember that you can if you take good notes and if you're reading your chapters and everything, you shouldn't have any problem, but then again, you should also be able to utilize your notes and your textbook during quizzes and tests. Okay, so Chapter 10 is drugs for gastrointestinal and related diseases. This is a lot of information in Chapter 10. It's interesting to me because I've known a lot of people who have had different GI diseases and stuff, such as Crohn's disease and diverticulitis. One of my really good friends actually had to have a colostomy done because she had such severe Crohn's disease. So this is very interesting stuff for me. I hope you guys find it interesting as well. These are just the chapter topics we'll go over, and just some different learning objectives here. We want to describe the gastrointestinal physiology, describe drug treatments for GI diseases, and those are coming up all the time with new medications are being approved all the time for GI diseases. I'm sure you've seen commercials on TV for different things that treat Crohn's, like Humira has a commercial right now that treats Crohn's disease and stuff like that. So they're coming up all the time with new ones. We're going to describe gastroesophageal reflux disease and its ramifications, discuss antidiarrheal agents and explain how they work, describe the role of fiber in the digestive process, discuss laxatives and their mechanisms of action, identify the chemoreceptor trigger zone and discuss its role in nausea, state the antiemetics that act on the chemoreceptor trigger zone and their mechanisms of action, and describe the measures to prevent and treat hepatitis. Again, we're not going to go in depth in every one of these slides. This is just an overview. Again, all of this information is in your textbook. We basically want to cover the main drugs that are associated with the gastrointestinal system and treatment of the diseases. So feel free to go over all of these slides at your own leisure. Again, I posted the PowerPoint in the course documents on your Blackboard. So this just lists the different organs that are contained in the GI system. If you've had biology at any course in either college or high school, I'm sure you're familiar with all of these different organs that are in the GI system. Can cover the gastroesophageal reflux disease, also known as GERD or heartburn. There's different symptoms depending on your level of GERD that you experience. Radiating or burning in the upper abdomen and chest, acid taste, and recurrent abdominal pain. There's different causes, but the main cause is reflux of stomach contents through an incompetent lower esophageal sphincter. Different foods and substances can cause GERD in different people. Some are more susceptible to GERD from different products than others. And there's several different symptom relief options, avoiding certain medications, smoking cessation, remaining upright for at least 3 hours after meals, and sleeping with your head propped up. So one of the main medications that's used to treat gastroesophageal reflux disease that's over the counter are antacids, things like Tums, Rolaids, anything that has that calcium carbonate as a main ingredient. How they work is they react with hydrogen ions in the stomach to neutralize stomach acid. There are some side effects aside from the terrible taste of them. We have constipation, diarrhea, stomach pain, nausea, and vomiting. They also leave a very chalky residue in your mouth, so you need to drink a lot with them. Let's see. There's some examples of the different agents that are classified as antacids that are over the counter. So we also have histamine H2 receptor antagonists. A lot of these are also, well, these are all actually over the counter, but they come in prescription strength as well. Tagamet actually was in the news recently. I think you've seen that about the lawsuit that and recalls that were associated with Tagamet. But the Zantac and Pepcid, those are very common H2 receptor antagonists that you can find over the counter. The way they work is they bind the H2 receptors in the stomach's gastric acid secreting cells. There's different side effects to consider as listed here, but the absorption of vitamin B12 can be decreased with prolonged treatment. And also you have to make sure that you're not taking other medications that within several hours of taking the Tagamet or Axid, Zantac, or Pepcid, because that can inhibit absorption of those other medications that you need. This is another very common, highly prescribed class of drugs that is used to treat gastroesophageal reflux disease. It's called proton pump inhibitors, or what we call them in retail and in hospital as PPIs. The most common probably is Nexium. Prilosec is available over the counter. Prevacid is available over the counter now. Protonix, I'm sure you all have heard of all of those. A good rule of thumb that we were taught on the job is if it ends in azole, A-Z-O-L-E, is probably going to be a proton pump inhibitor. Some of the side effects is headache, nausea, vomiting, and diarrhea. Can cause liver dysfunction. You want to use that cautiously in pediatric patients. Let's see. Caution with liver dysfunction. That's a really important caution to consider as well. So we also have peptic disease, which usually manifests as an ulcer. So a peptic ulcer is an ulcer or surface lesion along any part of the GI tract exposed to acid and the enzyme pepsin. So you have the different types of ulcer. You have the gastric ulcer, the duodenal ulcer, and stress ulcer. I'm sure you all have heard about those as well. The pharmacologic treatment of H. pylori is what we call that one. That's common. You can get that during travel. It's just bacteria that manifests in your GI tract and can cause a lot of discomfort. The main medications that we use are a combination of several different ones. So you have the bismuth subcitrate potassium, and that in combination with a PPI. So there's an H. pylori pack that is available if you work retail, and it contains Prevacid and then I think it's Pepto-Bismol, and then another antibiotic such as amoxicillin or clarithromycin. The way they work is the PPI or H2 blocker actually heals the ulcer, and the antibiotics destroy the bacteria in your GI system that are causing the problems. So another thing to be considerate of is that it also can cause renal problems. So there's different types of peptic disease treatments. There's coating agents. This is one that you're going to see a lot probably in retail pharmacy. It's called Carafate. Actually, we use that in the hospital a lot as well. We make several different mouthwashes with that because it can coat the lining of your mouth for things that are irritants for that. But the Sucralfate or Carafate is the brand name, performs a protective coat over the ulcer. It's used to treat duodenal ulcers, should be taken on an empty stomach, and it can cause renal dysfunction. So the prostaglandin E1 analog, Cytotec, replaces the protective prostaglandins inhibited by the NSAIDs or the non-steroidal anti-inflammatory drugs. It's used for NSAID-induced gastric ulcers, and the side effects can be diarrhea or abdominal pain, and it is considered hazardous, so that's one that you have to practice caution with. I believe that the Cytotec vials or bottles of the drugs themselves actually have the black label on them that say that they are a hazardous. I think they're either tier 1 or tier 2 on the NIOSH list, and things like that shouldn't be handled by pregnant women, especially they're at high risk, and then also you need to wear gloves if you're going to be dispensing that. So what classes of drugs are used to treat GERD and peptic disease? Just a little recap. There's antacids, PPIs, H2 blockers, and Sucralfate. And then there on the bottom are the other two. So another form of digestive disease is ulcerative colitis and Crohn's disease. So ulcerative colitis is the excessive inflammation of the GI tract, which causes ulcers, and it's limited to specific portions of the colon or large intestines generally. Crohn's disease is an autoimmune disease in which the immune system attacks the tissue lining the entire GI tract. Crohn's disease, like I mentioned before, it's a terrible thing to have to deal with. It wreaks havoc on you. I have several close friends who have had to deal with that, and that's just a terrible one to have to deal with. The similarities between ulcerative colitis and Crohn's disease, their symptoms are diarrhea, vomiting, bloating, fatigue, abdominal pain. You have unexpected symptom flare-ups, and there's different treatment options, and there's a lot of similar treatment options for those two diseases. One option is corticosteroids. They work by sorry, sidetrack. My dog came in here. I'm sorry. So the corticosteroids, that they come with a risk of infection for potential growth, of stunting your growth. Budesonide capsules need to be swallowed whole. Let's see. So the corticosteroids are used for the anti-inflammatory and immunosuppressive properties. There's several different examples of those. There's the Entecort, Solucortef, Medrol, Depomedrol, Steripred. I'm sure you have all heard of the prednisone and things like that before. Another option are aminosalicylates. The medications such as Asacol, Pentasa, Azulfidine, those are used very commonly to treat Crohn's and ulcerative colitis. The way they work is they're thought to modulate chemical mediators of the inflammatory response. So there are a lot of side effects that come with those, such as upset stomach, headache, pharyngitis. There's also immunosuppressants. Imuran or azathioprine. How they work as they suppress the immune system by interfering with nucleic acid and synthesis. Gallstones, those are another fun one. Definition is pebble-like structures that obstruct the cystic duct. Symptoms, the abdominal discomfort, sweating, nausea, vomiting. Gallstone dissolution agents, ursodiol. It decreases the cholesterol content of bile and bile stones by reducing the secretion of cholesterol from the liver and the reabsorption of cholesterol by the intestines. It's used for dissolving gallstones pharmacologically. A lot of patients report persistent nausea, vomiting, and abdominal pain, and the dissolution may take months. It also can cause liver dysfunction. Diarrhea. Diarrhea is defined as excessive, soft, or watery stools. There's different types of diarrhea. Acute diarrhea, which we would consider traveler's diarrhea, caused by food poisoning or drug-induced. Infectious diarrhea is caused by different contaminants that can be ingested. Salmonella, E. coli, protozoal infections. And then chronic diarrhea can be caused by irritable bowel syndrome, ulcerative colitis, and Crohn's disease, as we mentioned before. The effects of diarrhea can cause dehydration and impaired absorption of drugs, vitamins, and nutrients and toxins. Anti-motility agents are used to treat diarrhea. Says they need to be used in chronic disease states only, not to be used for short-term self-limiting diarrhea. It may prolong fever and delay clearance of microorganisms. So we've all heard of Pepto-Bismol. We've all seen those commercials, right? That's considered an adsorbent. It's bismuth salicylate. That works for nausea, heartburn, indigestion, upset stomach, diarrhea. I think that's the slogan of the Pepto-Bismol. The way they work is they act as an adsorbent, an antibacterial, anti-secretory, and anti-inflammatory properties. They do come with some side effects such as constipation, nausea, vomiting, darkening of the tongue and or stool. Rare serious effects include tinnitus, confusion, and weakness. Pepto-Bismol is definitely not one that you want to take long term. It's just used to treat occasional upset stomach or diarrhea. Anti-motility drugs, Lamodal, and Lamodal is one that you would see most often. It's a prescription because it is a controlled substance. That's important. Want to remember that one. And then Imodium, Imodium AD, those are available over the counter. Loperamide is also available via prescription. The way they work is they slow peristalsis, allowing more water to be absorbed from the feces as the colon contents spend more time in transit. Their side effects are dry mouth, blurred vision, flushing, urinary retention, and with Imodium, you can also have the drowsiness and constipation. Drugs for infectious diarrhea. So there's different types of the infectious diarrhea. A lot of them are caused from traveling, especially to third world countries. There's waterborne illnesses there that can cause severe diarrhea. The traveler's diarrhea also can be caused by E. coli that can be contaminated in your food or water sources. So the medications that are used to treat the infectious disease diarrhea are Alinea and Xifaxan. Those are prescription only. They work by interfering with the process necessary for anaerobic energy metabolism, and the Xifaxan inhibits RNA synthesis. All right, to recap, how do the drugs used to treat non-infectious diarrhea work? The bismuth salicylate or the Pepto-Bismol's anti-secretory action, antibacterial action, and also has some anti-inflammatory effects. That's because of the subsalicylate. That's a derivative of like aspirin, which is also an anti-inflammatory. Antimotility drugs slow the peristalsis, allowing more water to be absorbed from the feces. Constipation and related GI diseases. So there's different characteristics of constipation. Infrequent bowel movements, small stool size, hard stools, feeling of incomplete bowel evacuation. There's different causes as well, such as low fiber in diet, insufficient fluid intake. Some foods can cause constipation in different people, and there's different drugs that can cause constipation as well, such as heavy antacid usage and a lot of opiates, which also cause a lot of constipation. Treatment, there's different treatments. There's you have some non-drug therapy options such as fiber, regular exercise, plenty of fluids. I believe if you saw your physician and reported occasional constipation, that's probably their first course of action would be to increase your fiber intake and fluid consumption. There's also laxatives that relieve constipation. They usually are only used in a short-term basis because if you use them excessively, they can also cause dehydration. And then if you are looking for immediate relief, you have suppositories or enemas. So there's different types of fiber. There's insoluble or insoluble, and then there's different fiber supplementation suggestions. So we have the bulk-forming laxatives. They remain in the GI tract, drawing water and electrolytes into the GI system. This triggers peristalsis and facilitates bowel movements. They are usually used to prevent constipation. So things like Fibercon, Metamucil, Benefiber, a lot of those are ones that you dissolve in water and drink. Surfactant laxatives, for an example, Colace or X-Lax, those are also available over the counter, but they need to be used with caution. They act as a deterrent, helping fatty and watery components of the intestinal contents to mix, making the stool soft and mushy and easier to pass that way. They prevent constipation, so if you're on a regimen of an opiate medication that is known to cause constipation, a lot of times your physician will also prescribe Colace or X-Lax as a daily supplement to take with that, just to prevent that constipation. There's osmotic laxatives. We see these a lot in hospital setting. Lactulose is a very common one. We actually at UK we make lactulose enemas, so they can be taken, or lactulose itself can be taken orally, or it can be mixed with a number of other drugs and given as an enema. And then I'm sure you've probably seen the Miralax over the counter, polyethylene glycol. It can be used to treat occasional constipation, and it also is used to before, like, as a GI prep before a colonoscopy and things like that. Okay, we have laxatives now. Saline laxatives, magnesium hydroxide or milk of magnesia, and then there's the stimulant laxative, which is Bisacodil or Dulcolax. Those are also available over the counter. There's some other constipation agents. And then simethicone, it's an antiflagellant agent. That's also available over the counter. We see those a lot in pediatric patients in a hospital setting. There's just some information there if you would like to read over that. Okay, so the bowel evacuants, as I mentioned before, Miralax is one of those, the polyethylene glycol. That is used before as a GI prep before a colonoscopy a lot of times. And then the Fleet phosphate soda has the same effect. Those can also be used for GI prep. So to recap, provide an example of each of the following classes of laxatives. So we have the bulk forming laxatives. So it's methylcellulose, which would be like Metamucil and things like that, the Benefiber. Then the surfactant laxatives, Docusate, stimulant laxatives, Bisacodil. Other GI diseases that may accompany constipation. So we have diverticular disease, which is like diverticulitis or diverticulosis. It's caused by outpocketing from the bowel wall, which forms and becomes inflamed. They also have hiatal hernias, irritable bowel syndrome, and hemorrhoids. There's different treatments for hemorrhoids. One is hydrocortisone, which decreases inflammation. That too is available over the counter, the Anusol HC, or nitroglycerin, which actually you have to have a prescription for. But you have to be cautious with taking nitroglycerin because it can cause severe hypotension. All right, so nausea and vomiting. I don't know if you've ever heard of the chemoreceptor trigger zone before. This is something you probably should pay a little bit of attention to. It's going to be on your exam. So in the cerebral cortex, you have the hypothalamus, and then the bloodborne stimuli gathers there, and that's where it's called, in this little diagram, the vomiting center. This is what controls and regulates nausea and vomiting. Vomiting, or emesis, as is also referred to in, especially you'll hear that term a lot in the hospital setting. Effects can include dehydration, electrolyte imbalance, and aspiration pneumonia. There's vertigo, which is a sensation of the room spinning when one gets up or changes position, and it's usually treated with anticholinergic drugs. And then an antiemetic, is a drug that works primarily in the vomiting center to inhibit impulses that travel to the stomach and thus inhibiting vomiting. I think over the counter, the only antiemetic that's available, or at least when I worked retail, was one that was called cola syrup, which is just like a concentrated sugary syrup, which is supposed to help with nausea and vomiting. Antihistamines and anticholinergics. How they work. They block histamine and acetylcholine neurotransmitters in the CTZ and vomiting center. They both cause drowsiness, dry mouth, urinary retention, paradoxical excitement in children. There's different cautions to consider, such as high blood pressure or heart problems. And the examples of those would be Benadryl, Vistaril, Atarax. Those are antihistamines. And then the Antivert and scopolamine are anticholinergics. Serotonin receptor antagonists. They block 5-HT3 receptors in the brain and GI tract, stopping nausea signals traveling from the brain to the stomach. Things like that are Zofran. That's probably the most common one that you'll see, at least in retail and hospital settings. The side effects are dizziness, drowsiness, and just taking caution when driving. Dopamine receptor antagonists. Drugs like that are Phenergan, Reglan, Compazine. You'll see those often in retail setting. They block dopamine receptors in the CTZ. Prolonged use can cause liver problems. You're not supposed to use those in patients less than 2 years of age. So the NK1 receptor antagonist is called aprepitant. It blocks the NK1 receptor, thereby preventing substance P from stimulating nausea. Can cause renal impairment. All right, hepatitis. We've all heard of hepatitis. It's a group of diseases that cause damage to the liver. And there's different types. The hepatitis A is transmitted through blood and body fluids, often produces epidemics due to feces to mouth transmission. And there's hepatitis B, which is usually transmitted through body fluids or sexual contact or perinatally. And hepatitis C, important to note, hepatitis V can be prevented by vaccination as well as hepatitis A. Hepatitis C can be transmitted through blood transfusions or illicit drug use. There are a group of medications called antivirals and antiretrovirals that are usually used to treat hepatitis. They're listed here on the left side of this table. Just familiarize yourself with those. They are a lot of viral infections can be treated with antivirals and antiretrovirals. As at the Epivir HBV, it can treat HIV and hepatitis B, as well as the tenofovir. And that's just some more antivirals and antiretrovirals and combinations of both. So there's different alternative therapies for nausea and different GI disturbances. When I was working retail, we actually used to make ginger lollipops for either travel-induced nausea, or like if you had motion sickness, or if you were pregnant, they also used the ginger lollipops for those patients. It's supposed to reduce nausea associated with surgery, vertigo, motion sickness, some benefit in morning sickness, as I mentioned before. Thought to block serotonin 5-HT3 receptors. Side effects: heartburn, gas, bloating, mouth and throat irritation, and it does interact with aspirin, warfarin, and other anticoagulants. That's why it's important to know when you're taking a list of drug therapies from patients, they need to provide any over-the-counter or alternative therapies that they're also taking, because those can potentially interfere with a lot of the blood thinners and heart medications. We also have probiotics. A lot of yogurts that are on the market today promote probiotics. They contain live cultures of yeast or bacteria. They're used for diarrhea or constipation. There again, the H. pylori infection, antibiotic-induced diarrhea. They either compete and replace or displace harmful bacteria in your GI system. Okay, that's all of Chapter 10. If you all have any questions, please feel free to reach out to me via email. Again, just make sure you read Chapter 10. Go over the PowerPoint. You can watch the lecture video. If you just review those drugs, those major drug classes that we talked about. And again, if you have any questions, let me know. And I look forward to this class.